Newborns may acquire an infection with gonorrhea during delivery by transmission from the vaginal canal of the mother during a normal vaginal delivery. Typically, the eye has swollen eyelids and there's a purulent discharge in patients who have a gonococcal ophthalmia infection. Typically, treatment involves a single dose of an intramuscular cephalosporin, such as ceftriaxone, which is given to an infant that either has symptoms or is suspected of having this eye infection at birth. Rarely, newborns develop disseminated gonococcal infection, which consists of a number of features. The child may have features of sepsis, be in shock, be clingy, non-responsive, may have features of meningitis and have bulging fontanelles with a fever, or may have septic arthritis. Generally, these patients are treated for a much longer course with ceftriaxone again. Gonorrhea infections can also present in adults in a number of other ways outside of the genitalia. So patients sometimes will have pharyngitis, whereby they'll have a sore throat, they may have exudate and also surrounding lymphadenopathy in the cervical region. Rarely, they may exhibit the classical features of a disseminated gonococcal infection. And here there are three components or a triad to the symptoms a patient may exhibit. So they may have features of painful joints, painful tendon insertion of joints. They may have a rash, which is typically some small pustular painless lesions, although these can also bleed and also be nodular in appearance. And they may also have features of arthritis. So the patient may have an oligo or polyarthritis that tends to migrate. The patient may also have risk factors for a gonorrhea infection. So putting it all together then, the patient will have inflammation of tendon insertion points, a rash, and also polyarthritis. In terms of testing for gonorrhea, the most advised test is doing a nucleic acid amplification test. Typically, this is performed on first catch urine samples in men and on vaginal swabs in women that may be self-collected or performed by the doctor. For extra-genital infections, again, you can use the nucleic acid amplification technique on a pharyngeal swab if you suspect pharyngitis related to it, or on rectal swabs in the case of proctitis. So microscopic evaluation of these swabs may reveal the presence of polymorphonuclear leukocytes with the intracellular diplococci on a gram stain. Cultures using the media that we discussed previously, chocolate agar and Thayer-Martin agar, may reveal or isolate rather the bacteria. You can also then test for antibiotic resistance using these culture media. Treatment for gonorrhea involves using antibiotics to which the bacteria is sensitive and also treating for the possibility of coexisting chlamydia infection. For non-pregnant women who have urethritis or urogenital infection secondary to gonorrhea, the typical regimen is an intramuscular dose of ceftriaxone as a single dose and giving them an oral dose of azithromycin to cover for chlamydia. So treatment for adults with uncomplicated gonococcal infection relies on combination therapy with intramuscular ceftriaxone and oral azithromycin as single doses. Patients should be followed up for repeat testing 3 to 6 months following previous infection, because there is a risk of reinfection in those 3 months. Patients should also be informed that they should notify any sexual partners that may have been exposed to transmission of the disease. And if they fail to do so, they should be advised that screening notification can be done confidentially by also their healthcare provider.